A very good afternoon and welcome everyone. On behalf of Voice of Healthcare and Viatris, I share a warm welcome to my speakers and the attendees who have joined in for today's discussion. Since throughout the month of October, Voice of Healthcare has marked Breast Cancer Awareness Month through various initiatives, through various awareness campaigns, this panel discussion is also in the same view of awareness. On the view of Breast Cancer Awareness Month, this panel discussion talks about catch it early, save a life, protect breast. On the context of breast cancer, our panelists would be discussing all things that are important, right from screening, diagnosis, treatment, and also a little from the public health aspect of it. And to discuss on it, we have a very eminent set of panelists with us. I'd like to introduce my speakers. We have Dr. K. Madan Gopal with us. Sir is a senior consultant at the Department of Health Policy at Niti, Aayog, Government of India. Welcome, Dr. Gopal. Thank you so much for being here. We have Dr. 𝗖𝗛𝗙𝗖𝗛 with us. He is medical oncologist at Shankara Cancer Hospital and Research Center, Bengaluru. Welcome, Dr. Vivek. We also would be shortly joined by Dr. Mrunal Parab. She is consultant surgical oncologist at Masina Hospital, Mumbai. As soon as she joins, we'll put her on the screen. So without any further ado, taking this discussion forward, I'd like to take this discussion forward by asking a question to Dr. Vivek. Now, sir, how common is breast cancer and what are the different types of cancers specifically associated to breast? Over to you.
So the breast cancer is actually the most common cancer seen amongst women in our country. And what is alarming is the age at which it presents was initially, it was a cancer seen mainly in the elderly after 50 or 60 years of age. Now, more often we are seeing it in younger women. So 30s and 40s is where it is presenting. And there is each breast cancer actually can be subdivided based on further tests into 3 different varieties. But on a whole, breast cancer is any cancer which arises from the breast and proven by biopsy.
Right. And do you think there is a relation of maybe demographies or geographies as well in the incidence of breast cancer while we talk about, since India is a very diverse geographic nation? So do you think there is an incidence of that as well?
See, that brings us to the question of what are the risk factors for breast cancer. So with the adaptation of Western diet and Western culture and obesity playing a major role in younger women now, and some amount of alcohol consumption, some amount of delayed childbearing, avoiding breastfeeding, and delayed presentation to the doctor with symptoms are probably some of the risk factors. So it is more of an urban disease rather than a rural disease is what we can say geographically. And that's where the topic for today is very apt. Catch it early, save a life. I think more and more awareness programs are necessary on this regard.
Right. And that brings me to the question for Dr. Gopal as well. Now, sir, while we are talking about today's theme as well, which says catch it early, save a life. And also we mentioned about how risk factors are associated with maybe the lack of awareness as well till now. Now, sir, I'd like to ask you that despite of number of initiatives that we've been trying to take throughout these many years, yet in India, where awareness related to breast cancer is still on the lower side, how can public-private partnerships bridge the gap and increase screening and early diagnosis for the cancer? Over to you, sir.
Khushbu ji, is the second part which you have coming. First thing is the low level of awareness, particularly among the women. Because as rightly pointed out by 𝗖𝗛𝗙𝗑, saying that it's a more or less predominantly in the urban area. But we are having two situations. Do we having screening facilities across the country? Or are the women aware about that the breast needs to be screened, or they should be aware about the self-breast examination? With this kind of level of awareness, because if you talk to any woman, particularly in the rural area, what does a woman say when she is asked about, are you aware about self-breast examination? She says that, yeah, I usually take a bath. During the time of bath, I usually examine my breast. That kind of reply you will get. That situation is not different in the urban areas also. And most of the cases which are coming to light is when the lump is advanced, in an advanced stage, and the cancer has spread. You are detecting that. One of the important aspects, apart from the self-examination of the breast, is we have to tell them that the treatment is now available. It's a very good treatment which is available, and the survival rate is very, very good for breast cancer if it is detected early and the patient is treated. That messaging is more or less somewhat very challenging to reach all these masses. Having said this, that means if you look at the health structure which has evolved, we do have a national cancer NPCDC program is there, in which cancer detection is one of the aspects which has been looked into that. And that is been extended because after the change of the strategy from the primary care approach to a comprehensive primary care approach, wherein the population-based screening is happening. As a result, you have seen there has been a strengthening of the infrastructure. That means from the being upgraded to health and wellness center, and a community health officer is there, or mid-level service provider, who will be aiding in finding out and screening for the cancer. That is there, and some of the places it is happening. Now we are having an upgraded health and wellness centers, around 130,000 health and wellness centers are there, and around 3 crores, I think 3 crores are 30 million is 3 crore. Around 3 crore screenings have happened. But is that adequate? No. A lot more work is to be done. That's one thing. One is extension of the screening facilities. I'm not talking about the differential kind of screening, but inquiry saying that the lump is there or not, examination of the lung, clinical examination of the lung, and then segregating that person and doing the advanced testing and other thing. These facilities are now being extended as would be available. As we have seen that breast cancer is now replaced as #1 cancer among the women. Previously, whenever anybody goes to a clinical setup for screening, they usually screen for cervical cancer, and then the breast is forwarded. That is right from creating awareness at this level, at the level of the individual, to the providers. It's not that all the providers, they are competent enough to screen for the best do the clinical examination of the breast. They might have done during the surgical classes, but once it comes to practice, if you're not seeing patients, then you need to be reoriented and you recapacitate for this clinical examination. Having said this, many public and private things they can come together. You have seen the 𝗟𝗜𝗙𝗘 helpline, which has started by our former Vice President, 𝗘𝗔𝗥𝗟𝗬. That kind of examples where they have partnered with the government setup and see that how they can raise awareness in bringing people to the center, as well as seeing that they are screened and they are providing investigation facilities at the higher centers. That kind of efforts are there, but lot of scope is there. You see, we have created around 130,000 plus the community health center, plus the district hospital, and the wide network is there. To bring the people to this network, definitely partnership. And this partnership can be a win-win for both the people, for the public as well as for the private. Initiatives are there in the National Cancer Detection Program. We do support such kind of initiatives. And if you look at the example, how we have expanded the scope of the district hospitals. Now any private entity, they can come and they can partner with the public sector and open a medical college, so that care of cancer services can also be provided to that institutions. And in PMJ also, you see a lot of participation, but it's only focusing on the secondary and the tertiary care aspect of this breast. Breast cancer is the surgical procedures are listed out in the PMJ packages. That's the secondary thing when the cancer has happened. The cancer treatment is there in that, but in the sort of around 10,000 private hospitals are partner in PMJ. But are we satisfied with this partnership? No. We have to see that how these private players, they can expand the scope of services not for providing the secondary and tertiary care, but also preventive and promotive as well as primordial care for this women. Here comes the challenge. Are people coming forward to invest into this prevention aspect? So that's the challenge. We have to find an answer to this. I will stop here. Thank you.
Right, Dr. Gopal. Now, the points made clearly state that there have been initiatives taken by the concerned authorities. There have been existing public-private partnerships, but that does not deny the fact that there is a scope of improvement. There are a lot many scopes because we have a large number that we cater to. And also, you rightly specifically pointed out the fact of, let's say, reorientation of the care providers. That was one. And also the fact that there is still a stigma of incidence of breast cancer ki karna hai nahi karna hai, kaise detect kare, kaise jaye. So yeah, those are the things that we need to take care of, but we'll cover on in the last section. We have Dr. Mrunal that she has joined with us. Dr. Mrunal, can you hear us? Ma'am, if you can unmute. If you can unmute yourself, Dr. Mrunal. Yeah, can you hear us now? Dr. Mrunal, can you hear us?
That's it. Again, it has gone.
Dr. Mrunal, can you hear us? Hi, can you hear us, Dr. Mrunal? Anyways, while she joins back, I'll move further with the discussion. And my question here is for Dr. Vivek. Now, you've mentioned about the types of breast cancer. You told us about what is breast cancer, and also you mentioned about the risk factors. Now, moving on to the treatment and the options available, could you please let us know what are the various systemic therapies used for different types of breast cancer?
Yeah, I think before answering that, I think we need to just make sure everybody is aware about when do you suspect breast cancer. So any painless progressive lump. So the word to underline here is painless. Usually people associate cancer to some amount of pain that has been going on for generations. But the breast cancer lump is usually a painless and gradually increasing lump in either of the breasts that is usually noticed by the woman. So once they notice this, the next step is to answer two questions. First, is it a normal or a benign lump, or is it a cancerous lump? And the second question, if it is cancerous, where else is this particular cancer already there before it was diagnosed to? So for that, first we need to do a biopsy from this lump, and then the pathologist will categorize into one of the three varieties that we commonly see. Next, a scan is done on a case-to-case basis to see if it has spread to any other body parts. That will help us stage the disease. So once we know the variety and once we know the stage, then comes the treatment. The main treatment modalities here are surgery, chemotherapy, radiation, targeted therapy, and hormonal therapy. So depending on which variety of breast cancer we are dealing with, a combination of one or all of these methods are used to treat breast cancer. And as Sir was mentioning, with the advancements in technology, the amount of side effects that we usually see with chemotherapy have come down tremendously. And apart from that, we also have advancements in surgery and supportive care. So any woman, if diagnosed in stage 1, 2, 3, definitely has a high chance of a cure.
Sure. Thanks, Dr. Vivek, for this. Moving further, I would first like to check with Dr. Mrunal if she can hear us now. If you're here with us, Dr. Mrunal, can you hear us? Anyways, while we wait for her to join back, Dr. Gopal, you mentioned while you were speaking first that there is a lack of awareness and there is a stigma associated. Although, just to reiterate, how can we reach to the majority of the Indian population to spread awareness about this disease, keeping in mind that we are catering two types of Indias today, the rural and the urban population, which has different types of stigmas associated. So, could you please share your views?
Kushbu, as I have mentioned, that we are in the process of setting up around 1,70,000 health and wellness centers. So we have already set up 1 lakh, and these are to provide population-based screening services. That's an area where things are happening. Now you see that how the extension, because having a community health officer, a mid-level service provider, a nursing person is there, they have to do population-based screening, or people who are coming to the institution, they are screened for this lump in the breast, and they have been subsequently examined accordingly and referred to the higher centers. So one of the important tasks, as I mentioned in my opening statement, that if you go to rural area, self-breast examination promoting, you have a lot of literature about this placards and the easy material about the self-breast examination. But it's only restricted to that I am taking a bath and I'm examining my breast. Or if you come to the urban areas also, a similar condition is there. But how to make people aware about the breast? Notice, as Dr. Sai has mentioned, painless progression of a lump in the breast. If they have examined it and they say that some nodules are there, if the nodule size is increased, care. They should not be shy. It has to start from the adolescent. That means it has to start from the schools. In the high secondary school, you have to see that how we focus and make people aware that the teachers have to take responsibility at the school level, saying that if something is noticed and it is growing in size and is painless, then it's a cause of concern and we have to examine it and get a clinical examination done at the school level. We do have a school health program. In the school health, certain things are observed. The teacher and the student, they can at least help the coming doctor or the doctor who is there. They can facilitate the clinical best examination of that person. And if some investigations are required, we do have diagnostic facilities at the primary health centers, and the primary centers are the intermediary between the community health centers and the health and wellness centers. We do have X-ray machines there. A good most of them, they are upgraded to digital, because mammography, CT, ultrasound may not be available, but at least a high diagnostic X-rays can be taken at that level. And if it is required, they can be subsequently referred to the district level or the medical college level. Now, all the districts would be having eventually would be having medical college in the coming days. So that kind of facilities would be available. So important thing lies in how to make the people. One way is starting from the school, improving the school health program, how these people, they can be referred to the community health center so that they can be screened there by a doctor, clinical examination can happen. If required, diagnostic facility, that can happen. Second, one of the important area where during the COVID times we have seen is the teleconsultations. We do have a Sanjeevani portal. E-Sanjeevani portal is there after the telemedicine guidelines were released, and the ministry has come up with this telemedicine portal. But for this telemedicine or the telehealth to be successful, the first and the foremost important thing is how the woman or the child is coming forward, or the adolescent girl, she is coming forward for a lump, the breast. So this inertia has to be addressed, that how to bring the people forward and connect them to the system, either to telehealth or to the person who is there. Stigma and misconception, they have to be addressed. We do have community health volunteers, and if you look at the capacity building program for the ASHA workers. It's there how to help the people in doing self-breast examination. That is part and parcel of their work. But still, lot needs to be done. As you have mentioned, that the PPP is required, those are required to help this connect with the beneficiary so that they can come forward and get themselves screened. And rest of the network is already there. But the only thing is how to address the inertia of the people coming forward, getting themselves examined, unless they are made aware that this treatments are available and it is not having any social stigma and other things. That's another thing. Second thing is, whenever we are designing a campaign at that lower level, we have to involve the women. Whatever urban phenomena is, because the age at marriage is shifting in the rural areas as well. The age at conception is also changing there. With the change in the dietary habits, as the social media has reached that place, the change in the habits is also happening. We see that how to address that thing. Then you have to increase the awareness. There are many other groups available. We have to raise the awareness of that groups as well. And very importantly, we do have help desks at the hospitals. And most of the women, they usually come to the help desk. At the help desk also, as a part of routine when you are registering the patient, if some certain mechanism is created that they can inquire about lump in the breast or not, and kind of with a sensitive approach, if you can inquire about that, that will aid in screening of that. Apart from that, the rural areas and in the urban areas also, more or less the rural sector, we would have library set up in the urban areas also. The hearts and the bazaars which are there, which are common meeting place, there you can always have that kind of methods, interpersonal communication, addressing interpersonal communication issues at that place of congregation. That will be more effective. There are many ways of raising awareness, but the important thing is how to bring the beneficiary to the system. And if you are able to bring the beneficiary to the system, that can only be possible when we can inculcate the habit of self-breast examination. And the myths and the perception that only when they are taking bath, they are examining it, that's a different. When they are into some other acts, they are examining it, that's a very different thing. Self-examination, it follows the particular steps. We have to teach them the steps, and the moment, as Dr. Sai has pointed out, the painless growth in their breast, definitely medical care is to be sought. Over to you.
Right. Thanks, Dr. Gopal, for elaborating so many initiatives with us. But again, as you said, that we have initiatives on the place, but the question is how to make sure that the beneficiaries are benefited from the initiatives. Again, the self-breast examination is one specific let's say one specific awareness drive that we can focus on, and we have been trying to educate not just females but also the male counterparts, so that they themselves also may encourage their partners, or let's say the women in their lives, to encourage self-breast screening. I am sure Dr. Vivek would have a lot to elaborate on this. Dr. Vivek, moving on, now you've also told us various surgical options, and mastectomy is always required. We also want to know how the treatment options for breast cancer have been advanced. If we compare, let's say, 10 to 15 years ago and today, how have we evolved the treatment landscape throughout the time? Are there any newer therapies that are introduced, specifically when we talk about India? And how, on the larger aspect, is this helping to decrease the incidence ratio? Over to you.
So when we are talking about treatment, again, we cannot talk about incidence. Treatment happens once the event has occurred. So somebody comes to you with breast cancer. Over the last few years, the surgical techniques have improved to an extent that the recovery is much faster. And as you know, you just mentioned total mastectomy, that is removal of the whole breast. The other option is called lumpectomy, where only the whole lump in the breast is removed with some normal tissue so that there is no remaining cancer in the breast. So at the moment, there is no difference between removal of the whole breast and the lymph nodes in the nearby axilla. versus lumpectomy and removal of the lymph nodes in the axilla when radiation is available to take care of the woman who has undergone a lumpectomy. So whether you get the whole breast removed or only the lump removed, with the help of the doctor, the amount of recurrence is currently the same. So that misconception has to go, that you have to remove the whole breast in everybody. Secondly, most of the advancements are in the medical field, where in the sense the drugs that we use to treat these cancers are evolving every week, or rather every year. We have so many more drugs with lesser side effects and more effects. In the sense, why chemotherapy has so much of side effects is it is not a smart medicine. It doesn't know which is a bad cell, which is a good cell. Once given into the body, it kills all the fast replicating cells. Hence, you have hair fall, hence, you have nausea, vomiting, and pain, and all those things. So now we have medicines which will go and target only the bad cells and not affect the good cells. Hence, the amount of side effects that we see are tremendously coming down. So these are the advancements that we should know about. More and more tablets are coming in terms of hormonal therapy, wherein just by taking these tablets and being at home, the chance of a recurrence or the chance of prolongation of life is much higher.
Right. Thanks, Dr. Vivek, for this. In the last point, while you mentioned there are a lot of drugs that are now helping the let's say recurrence ratio of breast cancer. That poses a question for me to Dr. Gopal as well. Now, sir, my question was, I wanted to ask about the initiatives that the government of India has taken, but you more or less covered it via your last point made. While Dr. Vivek mentioned that there are a lot of latest drug therapies that are available, but do you think government can intervene in encouraging pharmaceutical companies for drug discovery and research work related to not just breast cancer, let's say every such cancers or every such diseases that are prevalent in India? Over
If
to
you
you,
look
sir.
at the schemes which have been mentioned in the government has been providing incentive in the form of performance like incentive schemes for the pharmaceuticals. That is there and it's yielding results. You look at the way the cancer drugs, they are part of the essential medicine list. As a result, the price of this is regulated so that it becomes more affordable and accessible to the common beneficiaries. Then apart from that, if you look at the way, if any new molecule of medicine comes into the market, a faster and easy approval mechanisms have been created. So that means the regulatory facilitation as well as performance linked incentives are there, incentives for bringing up this. Apart from that, efforts have been made to see that how the biomarkers are made available, biomarkers for detection of the cancers and other things. That work is in progress in that direction. See that how it moves there, so that the moment this kind of incentives are there, so that things are made more accessible and affordable. So another thing is, can we take the diagnostics to the beneficiary, to the last mile of the last mile to the beneficiary as possible? So we have to find an answer to that. But let's for the pharmaceuticals and for the regulatory approvals, things have been smoothened out, and there's ease of approval, fast approvals are there, and the price regulations are out there. So which is more or less beneficiary centric, but nevertheless more promising and more effective in the coming days.
Sure. Thanks, Dr. Gopal, for that. Now, moving on to my question to Dr. Vivek. This is the last set of questions that we have for both the speakers. Now, sir, you have told us about the various surgical options. You also tried to address the fact that mastectomy is always required or is all not required. Are there an option of partial surgical procedures as well? But the question here is, in the case that India is seeing a lot of detection in the later stages of breast cancer. So do you think there are some important measures that are to be taken both from the awareness end of a patient and also maybe suggestive interventions for the policymakers out there to make sure that we do not detect this cancer in a later stage where we have no many options available? Over to you, Dr.
That again gets us back to the first question of how do we spread awareness. I think at this point, the digital mammography can be put on vehicles, and the vehicle can go on into the society, which is already happening to rural areas. Different institutes send in their mobile mammography units, where village by village they start screening periodically and educating them about self-breast examination, not in a scientific manner. So this will help capture our disease in the earliest stages. So stage 1, stage 2, or some of them even in stage 3. And this would help us to treat them in a more effective way and cause more survivors and less relapses in the future. Again, goes back to awareness. How do we prevent it? Is awareness, awareness, and more awareness.
Right. So we pretty much get the point, Dr. Vivek, that awareness is the key for both for self-breast examinations and also to make sure that we do not detect the cancer in the later stages. Now, for Dr. Gopal, the last question to you, sir, would be, although you have very elaborately let us know the interventions that government is taking, and also the one key point that how to make sure that beneficiaries are there to get the benefits of the initiatives. You also slightly mentioned in the opening address about the reorientation of the care providers. Now, do you think that there is a need of establishment of standard treatment guidelines, or if in case there are already, do you think there is need to reassess those to make sure that our specifically while we are talking about rural areas, not everybody and not every care provider is well oriented enough for breast cancer examination. So do you think these treatment guidelines standardization is required? And
Yes,
also,
yes.
while you make this point, we can also let us know about the adequate number of health workforce that is there currently and how can we improve that and motivate our providers.
Okay, thank you, Pushpu. We do require standard treatment guidelines. So what is happening when we were conceptualizing the PMJ program, the packages in the PMJ program, there was a felt need that the institution should be having cancer boards, which can decide on the protocol, because one oncologist differ with his treatment way of treating the patients and the other patient will differs. For standardizing that, you can have standard treatment guideline, but it will vary depending on the patient condition. To overcome that, what has been suggested, what has been practiced, is you have a cancer the institution. A group of the people, they will decide the course of cancer treatment to be provided, whether radiotherapy, whether chemotherapy, whether surgical removal, or combination of either of the two or either of the three. So usually it is left to them, and we are trying to see that how this network, that is cancer board, the regional cancer boards, and the national cancer board, so that a treatment to be provided for a particular individual is standardized. If you talk about standard treatment guidelines for oncology, is very, very difficult because you can't be having standard. It can have an individualized treatment based on the recommendation of the boards, and that is a thing which has now been practiced. Second thing which you have mentioned about we do have National Cancer Breast Guidelines which were released in September 19, but they are all indicated. They are all suggested, but the ultimate decision has to be taken by the board at the hospital. Then second thing, the important thing which needs to be done is to evaluate all the women having done with triple test. Just a moment. Hello. Ji. Sorry for this. So I was talking about all the breasts which are to be evaluated by triple test. So one is clinical examination by an experienced medical person. That means a lot of scope is there for rebrushing his knowledge which he has taken during his college days. He is not practicing. Now you have to see that how whenever some lump is there, painless, that's the essential thing. It needs to percolate down to the providers. Any lump which is painless, progressing, that needs to be examined, clinical examination. Look at the spread, look at how other parameters of the patient. That's one thing. Even the radiologist who is doing the examination, the imaging services who are providing at the periphery, they needs to be capacitated of understanding. Otherwise, with the other load of work doing the X-ray chest and other thing, he will miss out the important thing unless he is aware what to look about that. Even now, abundant is plenty. If MRI and other things are not available, mammography is not available, then this ultrasound and this imaging can be very, very useful. So we need to train on that. Then we have to see that how we build on. All the district hospitals eventually would be having hospitals. There are only few district hospitals don't have a medical college. In medical college, essentially you have a mammography facility. But instead of loading the hospital, how we can screen the patients at the peripheral level so that the load of the hospital is reduced and the patient who requires a mammography is given that investigation. Then, as a medical college, histopathology, if a lump is there, can we do a FNAC histopathology on that? Three things are essential for improving the cancer screening as well as cancer treatment services. Apart from that, next is the adequate number of doctors. We do have around 18 lakh doctors, nurses, midwife. We do have that ratio, but more important is, do we things for detecting and referring the patient or treatment of this? If a treatment is provided, the higher center, can they act as a continuum? Can they provide continuum of care to the patients on treatment? Because we can't be having so many beds, because as the cancer rates are happening high, how many beds you can create unless you are having a mechanism of treating them at the place which is nearer to their house with the doctors. How many oncologists you require in the country? You can ask the oncologist. And even if you create a workforce of oncologists, you create this, but immediately that all of the facilities have been taken up to their fullest capacities. And it is very cost-intensive things. You have to work and find out how a cost-effective mechanisms can be evolved. Second thing is, we have to see that how the healthy workforce are being addressed. How you have to create a healthy workforce so that they can cater to the needs of all these people. So we have to focus on the workforce as well as other aspects of the workforce. I'll stop here. Thanks.
Right. Thank you, Dr. Gopal. And not just healthy workforce, a motivated workforce which is all set to cater and help us reduce the incidence, or not just incidence, but also to manage the breast cancer patients. With that, we are towards the conclusion of this discussion. Through these discussions, we just only aim, and we are just only hoping that while we are covering both the clinical and the public aspect of breast cancer, we hope that programs and initiatives like this at least contribute a bit towards decreasing the incidence and creating awareness regarding breast cancer. And we encourage all the females out there to kindly take up the self-breast examination on a timely basis, and please consult your concerned doctors. With that, we conclude today's session. In case Dr. Gopal and Dr. Vivek, you have some parting message to the viewers, you please can let us know. And with that, we'll conclude the session. Dr. Gopal can come. Yeah, please, Dr. Vivek, say. Yeah,
no, I think we have spoken enough about awareness and how to detect and how to treat. I think now it's we have to wait for this to percolate through the society, and hopefully it makes a difference.
Right. That's what we hope for. Dr. Gopal?
Lastly, only one thing. We have to see that how the message of self-examination of breast is taken seriously. People should come forward. We should see that breast cancer is treatable. Mortality is very, very reduced nowadays. The survival has improved. And we have to see that how our workforce is capacitated for doing the clinical examination. Stop here, but the important line is we have to create awareness so that people, they do self-examination. Whenever they notice any abnormality, they could come forward and seek medical guidance as early as possible, as a treatment is available. Thank you very much.
Right. Thanks, Dr. Gopal. Thanks, Dr. Vivek. We hope that these messages reach to the relevant audience at the right time. Thank you so much for your time. And with that, we conclude today's session. Thank you.
Thank you.